Hi friends, I'm going to show you a patient of dermoid cyst for whom we did a cystectomy robotically. The first step is insertion of the ports. Port insertion is a little different. This is the port positioning in robotic hysterectomy. There is one supraumbilical port, two ports which are 15 centimeter from this port, a little below the line, and there is one laparoscopic port on the left side. After the port positioning is done, the robotic arms are brought in. This C port is a camera arm. Camera arm and the two other arms are brought in. They are already draped with sterile drapes. We attach the instruments to the robotic arms. Robotic instruments are longer instruments, and unlike laparoscopic instruments, they get attached to the robotic arms. After attaching the arms, he is now bringing in the camera, and this camera is now getting attached to the camera arm. The patient that we are doing, this is the scan of the patient, my left hand. The first step is injection of vasopressin, followed by incision with the monopolar scissor on the cortex of the ovary. We try not to open the cyst and take it out intact as far as possible. The beauty of a dermoid cyst is that it is inside the stroma. That is why it shells out beautifully. There is a very beautiful plane. You can see my monopolar scissor is helping me dissect that plane. And very gently, using the elbow of my scissors, I am just taking out the entire cyst intact. Now it's time for suturing. I have changed my instruments. In my right hand now is a needle holder. In my left hand is the bipolar grasper. What I'm going to do is take a purse string suture in the stroma of the ovary. The target is that the cortex should just come together. Because it's a barbed suture, as I tighten the knot, the entire ovary will come together, and in the end, I will just take one suture through the cortex so that the two edges will come together beautifully, and that is going to be the end of the story as far as suturing is concerned. So this is the last suture. I have done a purse string in the bed and then brought it all together, and this suture will be cut. This dermoid will be placed in an endo bag and removed carefully without spilling the contents in the peritoneal cavity. This bag will be removed through the port at the conclusion of the surgery. We want to reduce the size. We have to rupture the cyst inside the bag. We have to suck out the contents so that the size becomes smaller, and it's not difficult to then remove it through the side port. So this is the conclusion of the surgery. As you can see, it's a beautiful surgery done without damaging the ovary, getting into the right planes, and that is why I love doing a robotic surgery for dermoid cysts. Thank you so much.